Good evening once again. I'm Chris Jansing in for Brian Williams, day 191 of the Biden administration. And we begin tonight with breaking news from the Washington Post. Critical new information about the Delta variant of the coronavirus. The paper has obtained an internal CDC document which contains urgent new warnings about the virus. The Post reports, quote, the Delta variant of the coronavirus appears to cause more severe illness than earlier variants and spreads as easily as chickenpox, according to the internal federal health document that also argues officials must acknowledge the war has changed. The Post goes on to report, quote, it cites a combination of recently obtained, still unpublished data from outbreak investigations and outside studies showing that vaccinated individuals infected with Delta may be able to transmit the virus as easily as those who are unvaccinated. Vaccinated people infected with Delta have measurable viral loads similar to those who are unvaccinated and infected with the variant. This afternoon, President Biden took a much more aggressive stance in face of the escalating COVID crisis driven by that Delta variant and continued resistance to vaccines.
This is American tragedy. People are dying and will die who don't have to die. If you're out there unvaccinated, you don't have to die.
The administration is now confronted with the reality that its work to stop the spread of COVID could potentially face a major setback. Today, the president acknowledged that threat and took the first step toward imposing tough new regulations that will affect millions.
It's time to impose requirements on key groups. Every federal government employee will be asked to attest to their vaccination status. Anyone who does not attest or is not vaccinated will be required to mask no matter where they work, test 1 or 2 times a week. If, in fact, you're unvaccinated, you present a problem to yourself, to your family, and to those with whom you work.
Tonight, the Pentagon says it will also impose the same rules on all military and civilian personnel. So, Dr. Gupta, the Post story of the Washington Post also reports tonight about the CDC document they obtained, quoting here, the document strikes an urgent note, revealing the agency knows it must revamp its public messaging to emphasize vaccination as the best defense against a variant so contagious that it acts almost like a different novel virus, leaping from target to target more swiftly than Ebola or the common cold. That got my attention, Dr. Gupta. What do you make of this new information? How does it change things?
Good evening, Chris. Frankly, I don't think the war has changed at all. And this is an indictment of ineffective, confusing messaging from the very top. Let's call it what it is. And I think your team actually has an image that I shared many months ago that my pulmonary colleagues and I have been trying to share and disseminate out. This is on the left for all your viewers out there. Those are healthy lungs. On the right, those are lungs ravaged by COVID that my colleagues and I care for in the ICU. That's acute respiratory distress syndrome. That's what the vaccine prevents. That message was never clearly communicated through images, through authentic messengers from the very beginning. So now people are saying, well, what's changed? Frankly, if you actually look at the CDC data that was presented in slide format, it's pretty darn clear that the vaccines, and they were looking at 2-dose Pfizer, Chris, 2-dose Pfizer was protective against hospitalization in Israel and Canada and in England. Even against symptomatic illness, we saw 87 to 88% protection. But against hospitalization, seeing somebody like me, you were nearly 100% protected. So I don't think anything has changed. What we are now dealing with is an indictment of ineffective, confusing messaging, making people think that now we're dealing with.
I want to make sure I understand, because my takeaway from this Washington Post article was that even though I'm fully vaccinated, I think everybody on this panel is fully vaccinated, we can still be carrying the variant, and it is so much easier for it to transfer, to transmit. And even though, again, and we've talked about this, and I think the messaging has been clear, if you're vaccinated and you do get this Delta variant, you're going to have a much more mild case. The idea of transmission and getting it at all sounds scary. So is this information, though, not new?
So that information is new. And so this notion of, but we have to think about this in context. I think, Chris, we have to take a step back and say, The CDC is likening this to chickenpox, for example. Well, it turns out even if you're fully vaccinated against chickenpox, you can transmit the virus. No vaccine's perfect against transmission. So what does this mean? This just basically means that, yes, there's a potential for transmission of the Delta variant to others. We think that's different from, say, the Alpha variant. It looks like the Delta variant is maybe 50% more transmissible, even if you're fully vaccinated. But Chris, ultimately, this just adds greater urgency to the notion of getting vaccinated. The Delta variant in and of itself to those who are fully vaccinated is not harmful. So immediate FDA approval and really broad consideration of a mandate, those are the things we need to be talking about in addition to better messaging.
And President Biden, Shannon, has been talking about this, but I thought today was marked by an even more urgent tone. Is concern in the White House rising day by day over this new variant? And how do folks there feel about their messaging on the virus?
Well, their urgency has certainly ticked up. I will say last week and maybe a little bit into the week prior, I talked to people within the administration, people who were close to the administration, advised the administration, and they raised a lot of these issues like requiring masks for certain groups, vaccine mandates for some federal employees. But I would say about a week ago, 10 days ago at this time, nobody was thinking it was going to happen as quickly as it did and as widespread as it has. There was talk about vaccine mandates for VA employees, for members of the military, maybe TSA screeners, not for the entire federal workforce to have to either be vaccinated or submit to really regular testing. You know, there was talk about requiring masks maybe for certain groups, maybe increasing the urge to nudge people to wear masks more, not this sort of about face on mask recommendations and saying that people who live in large swaths of this country, even if they're vaccinated, to be putting their masks back on. So I've noticed internally and people close to this White House a real shift in messaging over the past few weeks, which I think speaks to the growing urgency. As far as the effectiveness of that messaging, so much of this is being driven by the CDC and not necessarily by the White House. And that's where we have seen a bit of fumbling of the handoff of the baton in the messaging. We had the CDC hold a teleconference to announce this really big change in masks. The White House within itself was trying to figure out how to adapt this policy, even within their own walls, as to whether or not people needed to wear masks at a VP event, and whether the president was going to wear one at his event the next week. So certainly they're still trying to get their foot around the messaging. But when I talked to people in the White House, they said, part of that is just because of how quickly evolving this virus is and how rapidly changing the scenario on the ground has been lately. Yeah,
the push clearly, Julie, is hard to get vaccinated. I mean, again, besides the urgency, the other thing I took away from this press conference today was, okay, they've decided they need to pull out all the tools in their arsenal that they possibly can.
I think that's right. I mean, they have been trying for weeks to find messages, to find gimmicks in some cases, to find celebrities who can go out there and convince this group of people who are just stubbornly unvaccinated to start to move. And really none of those numbers have budged in a significant way. And so now the White House is taking this step that, I think in some ways they had hoped to avoid. The Biden White House is very conscious of not wanting to be seen as pushing, definitive mandates. So they're not even trying to use that word. They're calling these, these programs other things. You have to attest that you're vaccinated. They're trying to avoid the idea of a mandate, though essentially that is what it is. It's a mandate for a vaccine, and if you're not vaccinated, then you have to take other steps. They are just trying to pull every lever because ultimately, as Biden said, but as really public health officials have said, there is only one way out of this pandemic, and that is to increase the vaccination rate. And until this happens, we're going to be bouncing back and forth between new mask guidance, new guidance on how close we can interact with each other. And so Biden is just trying to make that part of the message that vaccinations are the only way out, really the centerpiece, I think, of what you're going to hear from him for weeks to come.